Jonathan Lemire, let me start with you. All eyes on the president's announcement, not that houses of worship may open, but the president having a very sharp tone and a very sharp message in his announcement today, really biting, saying that liquor stores were open, but houses of worship were not essential. What was behind that, and will it happen?
Nicolle, certainly a lot of Americans have been very anxious for their houses of worship, no matter what their faith, to reopen. And it's been telegraphed for some days now. The CDC and the White House indicated to reporters that that announcement was forthcoming. Originally, however, it was just going to be part of the press secretary's briefing today, slated for 2 o'clock. And with only a few minutes' notice, the White House suddenly blasted out to reporters that the president himself would be coming to the James S. Brady briefing room to make that announcement. You saw it there. He didn't take any questions. And the reason behind it, the behind the scenes, Nicolle, it's indeed, as much as it is about getting the churches open and synagogues and other places of worship, it's about the politics of it. The president wanted to be the face of this announcement himself. He knows, it believes that this is popular with his base. He did extremely well with evangelicals, for instance, back in 2016. And a lot of policy he has put forth since taking office has been with an eye towards the religious conservatives who supported him before. And he believes he needs their support again, perhaps even in greater numbers this time around. So this wasn't going to be something he just allowed the press secretary or even Dr. Birx or the members of the task force announce. He wanted to do it himself. In terms of an enforcement mechanism, that's not clear yet. A lot of the details are still being worked out. This is sort of a scramble here. The president said that you need churches and other places of worship needed to be open this weekend, and that he would, in his words, overrule or override governors. But it's not exactly sure what that means, because as we well know, as much as the president has been the cheerleader from the White House for the economy and for these states to reopen, the moment-to-moment, day-by-day mechanical decisions, those are being made by the states themselves and their governors.
Dr. Vermoyen, I certainly understand and agree with faith as essential, but houses of worship are not, most of them, structured yet in a safe, socially distanced way. What's your advice to churches or synagogues who heed the president's order?
It's very important for everyone to think about safety. We all agree that there is so much at stake for people here. It is an emotional decision. It is a decision of faith. It is decisions that are related to how people view themselves in the context of the world, but we also have to keep people safe. And what we know is that the risk of contracting the virus in places where you have poor ventilation, where you have crowding, where you are in close contact with other people, where you cannot social distance, that we are at risk. And so my advice to people would be to think about the science, to think about public health, and to balance that. To wear masks, to be in ventilated areas, to maintain social distancing. These are the keys to keeping people safe. And whether or not things open or they close, if we obey the laws of science and public health, that is how we will keep people safe during this time.
Dr. Vermoyen, what is your feeling about this reporting? I quoted some of the Washington Post reporting. The New York Times has also reported on this, that Donald Trump's public utterances about the virus are now tied directly to a very, very transparent strategy of his own reelection, to put himself on the side of bullish openings, in some instances in defiance of his own CDC and public health officials.
You know, I've spent my life working in epidemics, and politics and epidemics, and in this case, a pandemic, are inseparable. And unfortunately, that's what we're seeing roll out here. You know, any place that we have seen uncertainty in terms of messaging, in terms of what the science tells us, we see politics filling those gaps. And the problem is that we are dealing with a novel virus new to humanity. And so there is so much uncertainty, and we're seeing political rhetoric come in every place. We cannot have political rhetoric be the basis of how we make public health decisions. We cannot let politics infect public health. And that is our big problem here.
Mark Leibovich, doctor, I just heard the best political analysis about this moment that we're watching from a doctor. So I don't mean to raise the bar for you to now jump over, but let me give you some Fox News polls to work with. No, but I mean, that's a perfect explanation for what's going on. Right. That this is new. We just found out, like on week 7 of the pandemic, about a brand new disease that is very scary in children. We still are learning. There was an update today about surfaces not perhaps being as dangerous. I mean, there's a headline every day about what this virus is and is not. And I think that affects these poll numbers. Let me show you. This is from Fox News. Major problems in dealing with COVID-19. 63% of Americans think the lack of available testing is a major problem for dealing with the pandemic. 61% of Americans think the lack of a clear federal plan is the major problem in dealing with COVID. Only 39% see personal freedom violations as the biggest problem. That number is almost exactly where Donald Trump's approval rating is, actually a little less than his approval rating. So there's still more people worried about a lack of the things that Donald Trump is squarely in charge of, testing supplies and a federal plan. And really, a number smaller than the Trump base is worried about personal freedoms.
That is 100% true. I mean, I think we talk about this, or people tend to talk about this as a messaging and political phenomena. But as we're seeing in some of these numbers, people are experiencing this as an uncertainty in their day-to-day lives. I mean, there is genuine anxiety around this virus that is affecting, not only people who have lost people or who have lost jobs, but people who can't see their parents or grandparents or what have you. Kids can't go to school. I mean, this is not a Trump-era story that people are experiencing on TV. For the most part, like the Ukraine scandal and impeachment and Russia. I mean, Donald Trump is a TV star, and he is seemingly, especially over the last few weeks, he has kind of treated this as a messaging and a TV story. But really, the crux of this story and the emotional impact of this story is in the day-to-day of people's lives, and you can't really control that so much from a pure messaging or political strategy.
That is such a good point that, we covered the impeachment investigation and hearings and trial into the president because it was, only the third time in our country's history that it's happened. But that was a story that most people only related to the degree that they saw it on TV or read about it or learned about it. COVID is something people are living. I got into the car. I didn't have my mask. I went back upstairs to get it. I mean, people are living with not just the fear of the pandemic, but also the responsibility of being a good citizen in the time of the pandemic. It's been my sense that Trump has dealt himself out of the pandemic conversation a little bit, and it would appear that he wants to be dealt into the economy conversation, but not the pandemic conversation. Don't you think most people view them as completely braided together?
I think they do, and it's unclear if he actually wants to be at the forefront of the economy conversation right now, given what's happening with the economy and that there are weekly, job numbers that are really, really scary, and it doesn't look like that's going to turn around anytime soon. I mean, if you sort of look at it, why has Donald Trump been a major? He's always the major point of discussion because he's the president and he's Donald Trump. But the question of, does he take this anti-malarial drug? Does he wear a mask in Michigan? How is his relationship with Dr. Fauci? These are, again, sort of Trump-era reality TV issues that he is right in the middle of. And again, they're kind of interesting and they're fun to talk about, but these are not real-life matters for most people. And, it just shows you that the playbook that he has sort of ridden his campaign 3 years ago or 4 years ago, and the first 3 years of his presidency doesn't necessarily translate to what's happening now.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.